So here we're going to show you a very great way to open up the hip in flexion, internal rotation with varying degrees of abduction. Anytime you flex and internally rotate the hip, you have to be careful because it's an uncoupled motion. So what that means is when we flex the hip, normally we move into external rotation. Here we're going to be moving into internal rotation. Many ways of doing this movement, which we show many in our classes. I'm going to show one seated version now. So I want to butt my hip up against Kiki's hip, and with my closest hand, in this case my left hand, I'm going to brace underneath her knee. I like to grab my own bicep just to make it easier for me. So I'll grab my own bicep here, I'll grab her foot, and I just lean back, rotate, come back in. So I'm flexing and distracting, abducting, rotating away. This is the piece where you have to be careful, guys. So I'm flexing, distracting, abducting. This is where we have to be careful. We don't want to overcook this motion. Yeah. I like to hold, so I'm flexing, distracting, abducting. Then we add in our internal rotation and come back in. You can change the degrees of flexion, of course, depending on their range of motion, their degrees of abduction and internal rotation. What I find tends to work best is as much flexion as possible, or at least 90 degrees, and then internal rotation. Internal rotation with a flexed hip is a sign of a degenerative hip. We always want to restore internal hip movement. Let me show you on the other side. Can you face that way, Kiki? Turn around so your head's that side. So I butt up against the hip, I hook under, I grab my own arm here. You can grab your own hip, but you can just hold it here. I find if I grab my own arm, I don't have to carry the leg, the weight of the leg. So I lean back and I'm lifting up slightly. I abduct, then I turn my body, turn my head, 1, 2. Flex, lift, rotate. If you're finding this is hurting your back or you're getting tired, you may just need to change your body positioning. So if someone's really flexible like Kiki, I would come closer up more to her ribs so I can get here and rotate in front of me. Kiki's very flexible, right? So if I'm here, I have to really lean back to get the rotation. So I'll just come up more. So now my hip is near her sort of mid thoracic spine area, mid back. So I just lean and twist. And I twist everything. I don't just twist my body, I twist my head, my shoulders, and even my hips. 1, 2, 3. And of course you can change the cadence as with all these stretches, make it more rhythmical. But this is a great, easy way I find, I've been doing this a while, just to really open up the hip in flexion and internal rotation. How's that feel?
Good.
Good. Yeah. So you don't want to try. Be very, very cognizant of your body positioning. Make sure you're in a good position to work from. Another thing, scoot over to the left side. You don't want to be way over here. See, so my feet are not on the floor. I don't know if you can see my feet on the camera. But I'll definitely want if my feet are off the floor, it's very hard for me to generate any strength, and I'm really using my back. So I have the client move toward me. I use my hip. My feet are ideally on the ground. So if you're a short therapist, put a low table or put some sort of stool on the ground. Yeah. And don't forget this piece. So as I'm flexing, you see I'm lifting her leg, breathing out. As a rule, when we're stretching joint capsules, joints, we always want to be decompressing as opposed to compressing. Sometimes we do compress joints depending on what we're trying to achieve, but most of the time it's decompression and motion.